Hello, I am Dr. Suraj Chirania, consultant hematologist and bone marrow transplant physician. Here is a simplified explanation how AML is treated step by step. First, induction chemotherapy. This is first and most intensive phase. The aim of induction chemotherapy is to achieve remission, usually involves a 7+3 induction regimen. Hospital stay is common and that can be prolonged for 3 to 4 weeks. Second, response assessment. After 2 to 3 weeks, a bone marrow biopsy is done to check for blast clearance. Some patient may need reinduction. Third, consolidation therapy uses high dose chemotherapy to destroy any remaining disease, usually 2 to 4 cycles, essential to prevent the relapse. Fourth, bone marrow transplant, if needed, recommended for high risk or relapse AML. May use mass sibling, unrelated, or haploidentical donors. Fifth, supportive care and follow-up care include transfusion, antibiotics, antifungals, and frequent MRD monitoring. Continued care is crucial for long-term survival. In summary, AML treatment is a multi-step, aggressive, but potentially curative with timely planning. Stay informed and follow your hematologist advice closely. Thank you.